The Senate Health, Education, Labor, and Pensions Committee will please come to order. Today, we are having a hearing on a nationwide infant formula shortage. I will have an opening statement followed by Ranking Member Burr, and then we will introduce our witness. After the witness gives his testimony, senators will each have 5 minutes for a round of questions. And again, while we were unable to have the hearing fully open to the public, or media for in-person attendance, live video is available on our committee website at help.senate.gov. And if you are in need of accommodation, including closed captioning, please reach out to the committee or the Office of Congressional Accessibility Services. Let me be clear. The fact that we even have to have this hearing, the fact that shelves are empty, the fact that babies across the country are going hungry and parents cannot find what they need to feed their infants is a massive, unacceptable failure. And I've said this before and I'll say it again. The groups that families and caretakers depended on to help them in this moment, the FDA, infant formula manufacturers, all get an F in my book. There were plenty of warning signs about this crisis, and it seems like the people who are responsible for safety and supply here just blew through each and every one of them. And now, parents and babies are the ones dealing with the consequences. Now, Dr. Kaliff, I get that the FDA needs more people and more funding, and I will keep pushing to get you the resources needed to support your work, but I still do not get why some of the steps we're seeing now didn't happen a lot sooner. It's not like the FDA needed more warnings here. It's not like the FDA didn't have any idea this could be a problem. As far back as last fall, last September, just as FDA was conducting an inspection at Abbott's formula manufacturing facility in Sturgis, Michigan, Abbott and FDA received the first report of an infant sickened by Cronobacter bacteria after consuming infant formula. In October, an Abbott employee reportedly raised concerns with FDA about safety issues at that facility, which makes a huge amount of formula for U.S. families. But it took weeks for FDA to take action on the whistleblower's complaints and months for the agency's senior leaders to see the report, a matter of life and death importance due to, quote, mailroom issues. Dr. Kaliff, that does not instill confidence, nor does it explain away the many other warnings. In December, FDA and Abbott got a second report of a child infected by Cronobacter. Sadly, that child passed away. In January, a third report, and in February, a fourth complaint and a major formula recall from Abbott. Senator Casey and I sent a letter to Abbott promptly after the recall announcement way back in February when we first learned of these issues. We pressed for information about why it took so long to respond to these reports and demanded assurances that Abbott was taking every effort to work with its state, federal, and global partners to make this right and to make sure that it never happened again. We asked Abbott for documents about these safety issues by March 10th. That deadline came and went. Since early March, my office has been speaking with Abbott and with FDA about the issues related to that recall, including the supply of infant formula. But still, action was slow and information has not been forthcoming. Weeks after that conversation, FDA released the results of an inspection it started in January, an inspection which found contamination at the plant. Later in April, reporting highlighted long-standing failures in the FDA's food program, years-long delays, culture of inaction, decades of not prioritizing the food program. And it has all had a very real impact on families, including families who depend on formula. I will not allow the FDA to continue spinning its wheels on something as important as the food families feed their children. That is why I quickly sent a letter demanding answers from you, Dr. Kaliff. In that letter, I detailed the delay in FDA investigating the reports of potential contamination of Abbott formula, and I demanded information on how you will reform and improve the FDA food program. I have not yet seen a plan. Now here we are, months after Senator Casey and I first pressed for answers from Abbott and from your agency, so I can't for the life of me understand why things have gotten so out of hand. Now, the administration has taken some important steps recently, President Biden invoked the Defense Production Act to make sure infant formula manufacturers are at the front of the line for the ingredients that they need. Operation Fly Formula is now bringing millions of containers worth of formula directly to our shores, including yesterday's badly needed shipment. FDA has announced steps to increase the supply of safe and nutritionally adequate infant formula by increasing flexibilities on importation, and it has announced, alongside Abbott, that the Sturgis facility can soon start to safely resume formula production. This is all helpful, but let me be crystal clear. It all happened way too late. Back in 2021, when the first reports of potential contamination emerged, there should have been an immediate FDA response. And back in February, when Senator Casey and I recognized the need to get to the bottom of the formula recall, Abbott and the federal government should have been working together to make sure the shutdown of one plant did not explode into a crisis. Here we are. Now, I know parents won't rest easy until there's formula back on the shelves or until they can feed their kids, and I will not rest either. I'm going to keep pushing for more steps here in Congress, from the administration, and from the industry to fix this as soon as possible. Senator Casey and I led another letter to infant formula manufacturers calling on them to step up and produce more. We also led a letter to President Biden making clear there needs to be a formula coordinator at the White House leading a national strategy, because we have witnessed now how multifaceted this problem is. We need a coordinated response to ensure better accountability from industry, stronger FDA response, and swift action from the Department of Agriculture to do everything it can give to WIC recipients the flexibility they need. We also need to make sure that hospitals, NICUs, pediatricians, and state and local governments have the information and access to formula necessary to get the right formula to babies and infants with the most critical needs. We need to make sure retailers and suppliers are managing the supply in a way that is focused around families that need access to formula. And we need to get parents clear information and direction on what products to use, which products are equivalent, and where those products can be found or will be coming soon. It is incredibly frustrating to me we have yet to see a detailed plan for this, and that parents are having to coordinate things themselves on Facebook because the federal government still doesn't have a point person on this. So I'm going to keep pressing for answers for parents back in Washington State and across the country. Parents like Mac. He's a constituent of mine from Richland, Washington. He reached out to my office last week trying to find formula for his daughter and for other parents in the Tri-Cities area. Mac's daughter was born just 6 months into his wife's pregnancy. She remained in the NICU for 4 months before going home, and she needs a special kind of formula to help her grow and stay healthy. Because of this shortage, Mac has been searching high and low, day and night, to try and find it. Shopping at 6 different stores, getting donations from other parents on Facebook. His dad even brought 6 cans from Milwaukee, nearly 2,000 miles away. Mac is constantly worried about running out, and he has heard from parents across his community facing the same problem. Parents who are driving to store after store, finding only empty shelves, who are searching online and finding price gougers who are trying to profit off the fact that babies are going hungry. Mac spoke with another mom who said when her baby was discharged from NICU, she was given a sample can of specialty formula and some ready-mix bottles, enough to last maybe 4 days. And the Facebook group Mac started now has over 800 members just trying to connect parents in the Tri-City areas to formula. As a mother and a grandmother, I know parents in Washington State won't just go as far to Milwaukee to get their kids the formula they need. They will go to the ends of the earth. But they should not have to. We cannot leave parents to fend for themselves. We should be getting them the formula and the information they need as soon as we possibly can. People desperately want to know how soon can they get the formula their kids need to stay healthy. Where should they go for it, especially for people who need specialty formulas like formula for preemies or for children with allergies? And what is the administration doing to stop the price gouging, to end this shortage as soon as possible and to ensure that this never happens again. Parents need help, they need answers, and most importantly, they need formula now. I've been pressing HHS and the formula industry to help make sure we get families the formula they need. And believe me, I am not going to let up until parents like Mac can rest easy and don't have to call their senators for help finding baby formula. So Dr. Kaliff, I hope to hear from you today about exactly what steps the administration is taking to make this happen, as well as how FDA will address the pattern of delay and dysfunction we have seen throughout its food safety and nutrition efforts, not only its unacceptably slow response to complaints of contaminated formula, but also its stalled progress on other critical health, safety, and nutrition issues. With that, I will turn it over to Ranking Member Burford for his opening statement.
Madam Chairman, thank you for holding this hearing. It seems like you and I have been talking about plans a lot lately. And I want to really thank the members. The level of participation in this hearing outstrips anything we've seen, and I'm appreciative for that. It's time that we hold the FDA accountable. There are millions of families that care for babies with the help of a formula. Babies with special needs, dietary restrictions, adopted families and foster families, orphan families, children with mothers who are immune compromised or on life-saving treatments, women who can't breastfeed, and some cancer survivors. I want to share a story with my colleagues about one of those millions of Americans. A young woman called my office last week after weeks of desperate searches to find a specific formula for her young child with special dietary needs. She cares for and protects her baby with fierce love and devotion and had done her research on the formula shortage. When she called my office to demand accountability from her government, she was confused that the White House seemed to be blaming the formula manufacturer. Abbott began flying formula to the United States from overseas in February. 11 million pounds since February, 50 flights a week, 6 to 8 flights a day, 132,000 cans to 12 different airports across the country. There's something we haven't heard. Abbott knew there was a shortage problem, but FDA seemed not to. Abbott's been very transparent about what problems they faced and what they're doing to fix the problems. Their CEO even published an op-ed apologizing for their part in this crisis. This month, CDC closed its investigation into the infection of 4 children, finding no direct link to the manufacturer's facility, but the FDA only just now began to use tools to increase the supply of formula. And FDA still hasn't authorized the Abbott lab to resume manufacturing, even though CDC determined the original contamination did not come from Abbott's Sturgis plant. The question I could not answer for my constituent is what took FDA so long? Why wasn't action taken when the warning signs of this crisis started last fall? She asked if we knew what the FDA stands for. Before we could reply, she said, formula doesn't arrive. Formula doesn't arrive. FDA. My friends, the FDA failed to do its job, plain and simple. This isn't a story about funding. Congress provides over $1 billion for the Food Center alone every year. This Congress even gave them an additional $700 million in COVID money. $436 million of it is still available. The House passed a bill to give an additional $28 million to the FDA. Ladies and gentlemen, that's called political cover. This money's a stunt, so people could go home and say they did something. That's dishonest at best and blatantly irresponsible at worst. The American people know better whose fault it is here. This isn't a story about authority. The Food, Drug, and Cosmetic Act authorities are clear. The flexibility you have is real. No, this is a story, a sad story, about FDA's unwillingness and inability to do their job. During the pandemic, the FDA apparently stopped its safety inspections. That seems like a bad decision. And when the FDA finally resumed inspections, they failed to act with speed. Dr. Kaliff, you were confirmed in February when the nationwide formula shortage was at 26%. There was a problem. You and your agency failed to solve it. I challenged you at your confirmation hearing to learn lessons from the pandemic. The FDA did a great job for 18 months. But what I cautioned against is already happening. FDA is slipping back into its bureaucratic bad old ways. The FDA gets $6 billion from Congress each year, over 18,000 staff. Yet you fail to prioritize the things that matter. For the past 2 years, the Food Center ignored formula crisis until it became a political liability. Instead, the center focused on reducing salt in food, what kinds of salad dressing we can call French dressing, and the ingredients that can be used in yogurt. You had time to decide what color additives can be added to make farm salmon look more pink and work on consumer acceptance of grated Parmesan cheese. Infants, babies, and toddlers are starving, and parents are facing the reality that they can't feed their children in the United States of America, and your food center is more interested in policy marketing claims about cheese than ensuring American families have formula to feed their babies. When you finally took steps, the formula shortage had reached an alarming 43%. The FDA has imperiled the health and safety of American families. You've created shortage and crisis. You've created panic and fear. Yesterday, in testimony to the House, you tried to shift the blame. The mailroom didn't deliver a whistleblower complaint. It's your mailroom. And FDA knew there was a problem even before the whistleblower sent the letter, strike one. Yesterday, you said you were new, but the president hired you and the Senate confirmed you because you'd been there before. And your center director has been there for almost a decade, strike two. Yesterday, you said the FDA could have done a better job. That's painfully obvious, but where's the accountability? Maybe that's strike three. By the time Abbott resumes production, after finally getting approval from your agency, which it still doesn't have, it'll take 2 months for their production to go back to capacity. That will be a success for the private sector. That you are acting only now under pressure from outraged parents around the country and from Congress deserves some serious searching. When I begin my round of questions, I expect that you'll answer my first questions in your opening statement. What did you know? When did you know it? Why did you fail to act for so long? The Abbott CEO apologized for their mistakes. I wonder if the FDA will apologize for their mistakes. I thank the chair for her leadership on this issue. I thank her for her shared moral outrage at the failures of FDA, and I thank her for getting the current FDA commissioner to appear so quickly before the committee. I yield back.
Thank you. Our witness today is Dr. Robert Kaliff, the Commissioner of the Food and Drug Administration. Thank you for joining us today to talk about this crisis. I know families in my state and across the country are following this very closely. So you may begin your testimony.
Chair Murray, Ranking Member Burr, and members of the committee, thanks for inviting us to testify on the safety and supply of infant formula in the United States. And I appreciate the 10-minute allocation. Ensuring that infant formula is safe and nutritious is a solemn responsibility of the Food and Drug Administration, and we're working with our government partners and the industry that produces infant formula to stabilize the supply. We're fully aware that many parents and caregivers have been unable to access the infant formula products that they need. Many of us are grandparents and grandparents too, and we want to express our deepest empathy for parents and caregivers who are experiencing difficulty and stress as they attempt to find formula. I personally have been driven by memories of the month my daughter spent in the intensive care unit as an infant, and the deep concern and anxiety of a parent driven to protect an innocent child. We provided you with an extensive written testimony that describes the recent history of this problem and gives a detailed timeline. During this hearing, I welcome reference to this document. On September 20th, 2021, FDA learned of a Coronabacter Sakazaki infection in an infant who consumed formula produced at Abbott Nutrition's facility at Sturgis, Michigan. Our detailed written testimony and timeline specify the chain of events that culminated in a for-cause on-site inspection of the Sturgis facility on January 31st, 2022. While there are many steps along the way where different actions could speed up the sequence of events, to this date I can find no evidence of intentional delay or malfeasance. I believe we have the facts delineated at this point, and we have initiated an internal after-action review so that we can make improvements to prevent delays like this in the future and improve our decision-making. I've asked Dr. Stephen Solomon, director of our Center for Veterinary Medicine, to lead this review. Before leading the Center for Veterinary Medicine, Dr. Solomon served in the Office of Regulatory Affairs and has deep organizational knowledge of the processes in the food program as well as compliance and enforcement. The FDA and CDC's investigation could not conclude, as you've stated, that the egregiously insanitary conditions in the Abbott facility caused the illnesses reported in our timeline. We cannot rule it out either, as the confluence of events is highly unusual. There is no dispute that the facility was unacceptably insanitary, as evidenced by the consent decree. Frankly, the inspection results were shocking. Standing water, cracks in key equipment that present the potential for bacterial contamination to persist, particularly in the presence of moisture, leaks in the roof, a previous citation of inadequate hand washing, and current poor foot sanitation, bacteria growing from multiple sites, and many signs of a disappointing lack of attention to the culture of safety in this product that is so essential to the lives of our most precious people. As a clinician, I've used life-saving clot-busting drugs, diagnostic tests, and cardiovascular devices made by Abbott. This is so far removed from my previous experience with the company that I remain very concerned. As soon as we received positive Coronabacter results from environmental samples at the facility that we collected during the inspection, we contacted Abbott to ask the company to issue a voluntary recall. The need to take urgent action to protect the most vulnerable of all of our people, infants, presented a dilemma. This was the largest plant of the dominant manufacturer, and it was the sole source of a number of metabolic formulas essential for viability of infants with no substitution possible because Abbott had no backup plan. We knew that ceasing plant operations would create supply problems, but we had no choice given the insanitary conditions. We took several critical steps within hours, including meeting with those who have been dealing with our supply chain throughout the pandemic, and a memo was sent to relevant agencies signaling the supply chain risk. We acted early to ensure the specialty metabolic and amino acid products, for which Abbott was the sole producer, were made available on a case-by-case basis, consulting with nutritionists, pediatricians, and safety experts. We contacted companies in the industry to encourage increasing their production to supply the market. We asked retailers to place temporary limits on how much any one person could buy to minimize excess buying. We remain in frequent communications with our government and industry partners about the status and risks. Because of the lack of diversification of this market and the absence of a central hub for integrating supply chains, we concluded early on that getting the Sturgis facility up and running safely was a top priority, but we had no confidence in the integrity of the Abbott quality program at this facility. Accordingly, we initiated proceedings toward a consent decree which requires Abbott to undertake steps to assure safe production of formula, including hiring outside expertise with reporting to FDA. Our oversight is critical, but make no mistake about it, the return to normal will only occur when Abbott takes the steps to resume production in a safe manner. As detailed in the charts included in your written testimony, we and our federal partners have been monitoring the in-shelf stocking of formula and the rates of infant formula consumption all along. Due to the efforts of other companies to step up their production, sales of infant formula have remained steady, and in fact, volume and quantity of formula purchased are 5 to 15% higher now than in the month before the recall, as demonstrated in charts included in the written testimony. Despite the overall numbers showing diminished but steady supply, we knew that distribution was an issue. Some areas were experiencing significant shortages, but overall there was enough formula to go around. About a month ago, the reports of shortages on the shelf proliferated, although there was not a drop in production. This increase in consumption most likely represents heightened concern of parents and caregivers about shortages, leading to understandable effort to purchase ahead to ensure adequate supply at home. I want to emphasize again, this is not blaming the parents and caregivers. This is rational behavior based on the concerns that they had. This type of cycle has happened with other products throughout the pandemic, and we realize that the only solution is to have adequate supply to make sure the shelves are stocked. To that end, we've employed a host of measures to increase supply. A consent decree was signed with Abbott Nutrition last Monday that will allow the Sturgis plant to get back in production mode. I met with the Abbott CEO day before yesterday, and he assured me they'll be ready to go in early June. They've now given a date of June 4th as when they'll be back in production. We continue to work with current U.S.-based manufacturers to increase the production and distribution from FDA-inspected facilities, both domestically and abroad. I commend them for their efforts in this regard as we've seen substantial increases. We're helping with the all-of-government response, including Operation Fly Formula, encouragement and support of importation of product not currently in the U.S. market, by using careful case-by-case easing of regulatory requirements to safely increase the number of manufacturers allowed to import formula, working with state health commissioners to increase flexibility with WIC contracts to enable additional infant formula suppliers to enter the market and to catch price gougers. Throughout the time since the recall, a highly dedicated group of experts within and outside the FDA have worked to manage the complex issues encountered for those caring for infants with complex metabolic issues requiring very special formula. I'll leave you with several thoughts. First, FDA's timeliness of interviewing the whistleblower and getting into the facility for a for-cause inspection were too slow, and some decisions in retrospect could have been more optimal. I did not return to FDA to preside over business as usual. After years of working in multiple private and public parts of the industry, I believe that success follows proper attention to structure, function, leadership, and resources to support the work of employees. All of these issues need attention in the chronically underfunded food side of the FDA, and you'll see changes in the near future. Our requests for funding and authority are essential in concert with improved operations and leadership. Second, the return of the Sturgis plant to safe production of formula is critical. Abbott's enormous market share left it with a responsibility for producing safe infant formula that was not met. We'll do everything in our power to work with Abbott to make this happen as quickly as safely possible, but this timing is in Abbott's control. Third, the all-of-government effort and the enormous goodwill of government partners and companies within and outside the U.S. has been heartening. And while we're waiting for Abbott to fulfill its responsibility, we'll meet the essential needs of American families with supplies from a variety of sources. Fourth, the supply of inadequacy did not happen overnight. Across the industries we regulate, we're seeing evidence that the just-in-time distribution system, market concentration, and sole source contracting are leading to shortages. Multiple reports to Congress call for improved supply chain management. Until regulatory agencies have digital access to critical supply chain information and personnel to do the work, we'll continue to react to supply chain disruptions rather than intervening to prevent them. I want to conclude by reiterating that we'll not rest until our shelves are replete with safe and nutritious infant formula, and I'm committed to improve the ability of the FDA to meet its mission to protect and promote the health of American people, particularly infants, our most vulnerable people. Thank you.
We will now begin a round of 5-minute questions. I ask my colleagues to keep track of the clock, stay within those 5 minutes. Dr. Kaliff, parents and caregivers across the country rely on the FDA and the handful of dominant formula manufacturers to make sure that formula that they feed their babies meets the highest standard of safety and nutrition. But the companies and FDA let them down. I am ready and willing to continue working with you and absolutely anyone to get this right and make sure we never are in this situation again. But I want to be clear about where we are in the current moment. Babies have gotten sick. 2 have died after drinking formula from Abbott Nutrition Michigan facility, and it took months. In fact, you are telling us today it took 6 months for FDA to investigate. During that time, Abbott continued to produce formula at the Michigan plant. And when FDA finally completed an on-site inspection, months after the first baby became ill, It found evidence of the Chronobacter bacteria on surfaces where formula was being produced and a history of Chronobacter in finished baby formula products. That is incredibly alarming. So it makes sense the plant was shut down as Abbott and FDA tried to figure out why babies were getting sick, and as your inspectors uncovered substantial long-term problems at the facility. What doesn't make sense, what I can't for the life of me figure out, is why it took so long to investigate in the first place. Why did so much time pass before the FDA took serious action to investigate this contamination in baby formula?
Well, Senator Murray, I appreciate the question, and I think we all have a great degree of sorrow over the difficulties that you're describing. Many people at FDA are not sleeping at night. They're working weekends and trying to get this corrected. There's no question it's just not a good
Well, I'm
result.
asking the question, why did it take so much time?
Yes. So I want to parse one issue with you. I have many more disagreements with Senator Burr about some things that were said. But from the very first case, there was investigation going on. It didn't take 6 months to start the investigation. That very first case, you have to collect samples.
No, I'm asking why it took 6 months to take serious action.
Because the answer to that question is, as in our document, there are systemic issues at FDA and in our interactions with the industry and our authorities that need to be corrected. It's clearly laid out in the document.
Do you have a plan to do that?
Yes.
And when can we see it?
When can you see the plan?
To correct these problems, yes.
We have a plan, but a complete plan written out, we'll have to get to you as soon as we can. I can't give you an exact date right now.
Well, okay. Has Abbott told you why it kept producing formula when it knew it might be dangerous for babies?
They have not, and I'll remind you that we ended up in legal proceedings with Abbott. We could not get control of the quality in the plant without going through a consent decree process, which has limited our ability to discuss it because it's a serious legal proceeding, as you know. What I do know is that they now have good plans underway to correct it. They were overseeing every step of the way.
For parents of preemies like Mac, my constituent in Richland, what is the clear message from FDA and HHS on how and where he is going to get NeuroSure or an equivalent formula for preemies?
For any infant requiring specialty formula, we have a committee and a whole host of pediatricians and specialists who are constantly in contact. The physician involved should be able to contact through the specialty societies access to the needed formula.
Well, what I'm asking is exactly what should parents know. I want to be able to say to Mac that you, Secretary Becerra, are telling him directly where he can go to get the formula. He and many other parents.
A parent needing a specialty formula should start with a pediatrician. If the pediatrician is not in the loop, one should go to the HHS website and call HHS, and we will intervene directly to help out. There's a committee in place to do that for each individual infant.
Well, look, when this hearing is over, I expect you and the Secretary to do everything possible to make it very clear to parents like Mac across the country what they should know to be able to get, going to be able to do to keep their babies out of the hospital. Very clear, direct to parents across this country.
I understand.
Senator Burr.
Thank you, Madam Chairman. Dr. Kaliff, Abbott submitted his paperwork for reopening the Sturgis facility to the FDA on April the 8th. 7 weeks later, the facility is still closed. Do you have permanent inspectors every day in the Sturgis facility helping Abbott identify the contaminations that the inspectors found?
You have some incorrect information. Abbott did not submit adequate documentation on the date that you referred. That was only done on the last day.
Do you have inspectors today in the facility every day helping Abbott get the plant up and running?
We have inspectors working with Abbott every day as they're working on it. No, not in the plant.
Okay.
No.
Why haven't you waived labeling requirements from trusted manufacturers in countries like the UK, Australia, or Canada? Couldn't manufacturers provide temporary labels on imported formula cans if the label is printed in a language other than English until U.S. manufacturing is restored? Some countries have higher nutritional requirements. Why can't we provide a waiver for their products to come into the country?
We've waived many of the requirements, the ones that make sense, but the directions have to be clear to Americans in language that's understandable so that the formula can be mixed up correctly. An error in mixing up the formula, for example, can lead to a very sick infant not getting the right nutrition.
Dr. Kaliff, complacency is apparently the FDA's catchphrase when it comes to infant formula. In FY21, the FDA received 42 submissions for new infant formulas. The agency was able to review only 15 of those submissions within 90 days. That's 1/3. What happened to the other submissions? Did you expedite the review of the new formula submissions when you took the helm at the FDA amidst a growing shortage? By law, the FDA has 90 days to review new infant formula manufacturing submissions. What's the average number of days it actually takes for the FDA to review these?
Senator Burr, FDA employees are working around the clock, and they are hardworking people, so I somewhat resent the implication of part of that. But
Dr. Kaliff, there's no member that's defended the FDA more than this one, and there's no member in Congress that has tried to fix areas when they are broken than this one. If you want to get into this with me, I'm happy to do it. I got 28 years worth of it.
I know you're quite capable of that. So let me just say, right from the start, any good application was expedited by the FDA since the shortage became evident.
So 42 minus 15, the rest of them were not good
I
applications.
think you were referring to 2019 or something you said?
No, it was FY21.
Yeah, I'll have to get back on the details on that.
Listen, the FDA Food Center, let's talk about it. It has a staff of 4,000 people, but according to your own budget documents, there are only 9 staff reviewing infant formula applications. Did you or other FDA leaders assign any staff to review infant formula as the shortage percentages rose sharply?
We pulled in people from all over the agency to help that short-staffed group, which of course,
To process applications.
I'll have to go back and see exactly how they spent their time, but looking at all of the activities of that group, they were supplemented by staff from across the agency, which of course means that other things didn't get done.
Do you have the authority as commissioner to move people around as needed?
Yes.
Okay. Dr. Kaliff, I've looked at an initial review of some of the activities of the Food Center, and I'm concerned with your prioritization of the activities with the staff you have. Since the voluntary recall, for infant formula, FDA Food Center spent time making changes to the definition of yogurt, opining on color additives in the Antarctic krill meat, that's fish food, so farms can raise salmon that looks more pink, making announcements about the use of the term of the definition healthy. Since the first infant hospitalization, the same center has issued a rule on the definition of French dressing and issued guidance on cheese and chocolates that stray from the FDA's official definition. This is a pattern over the last decade. The same center has gone after salt, sprinkles, and even the definition of frozen cherry pie. So my question is simple in conclusion. What are your priorities at the Food Center?
The Food Center has a broad set of mandates, as you well know, but there's nothing higher priority than this particular issue that we're discussing today. It is the highest priority. We're assigning every resource that we can to work on this problem.
Well, I hope that the chair's request did not fall on deaf ears, that a detailed, comprehensive plan should be something that you could produce now if, in fact, the agency's working at the expedited pace that you addressed. If it's not ready today, I hope it's in the very, very near future. Thank you, Madam Chair.
Thank you. Senator Sanders.
Thank you, Madam Chair. Dr. Kaliff, concentration of ownership in our economy is a major problem in many sectors. It's true on Wall Street, it's true in energy, it's food production in general, and it is certainly true in the production of infant formula, which is so terribly important to millions of parents with babies. Right now, we have 3 companies, Abbott, Mead, and Nestle, who dominate the entire market. We have recently been discussing contamination at an Abbott facility. Tomorrow it could be Nestle. Are you concerned, and what are you doing about broadening the number of companies who are producing infant formula?
I'm very concerned, and as I said in my opening remarks, it's not unique to this industry that we're seeing concentration
Right.
that puts everything at risk. And I'll remind you, as you well know, there is no requirement that companies show us their backup plans.
Right, but
And
all
so-
I'm asking, and I've got other questions, is what are you doing right now to aggressively make sure that more companies are producing infant formula so we'll not see this problem recur
Well,
tomorrow?
as you know, I'm sorry, Senator, to interrupt, but
Go
yes,
ahead.
on a temporary measure, we've lowered some of the, reduced some of the paperwork so that many more foreign manufacturers can import. We've got 26 applications since we opened the portal just over a week ago. The largest producer, Nestle, worldwide, hardly had any presence in the U.S., and they're going to help out quite a bit. They're very capable.
All right, I hope that you will focus on increasing the number of companies who are producing so we don't run into this problem again.
Yes.
Let me ask you this. On October 20th of last year, a whistleblower sent a 34-page report to the FDA describing in detail how the equipment in Abbott's manufacturing plant in Michigan, quote, was failing and in need of repair, and that the company knew that this was a problem for at least 5 years. According to this report, Abbott falsified records to cover up deficiencies at its plant, improperly trained employees, and successfully hid health and safety risks from FDA auditors in 2019. And even though this report was submitted to your agency last October, FDA did not interview the whistleblower until late December. Now, my question is, during that same period of time, Abbott saw a $7 billion increase in its profits, and its CEO, Mr. Ford, saw very substantial increases in his compensation packages. If a company lies to the FDA about its safety situation, at the same time it does massive stock buybacks, gives the CEO used compensation packages, are you going to fine them? What are you going to do to make sure the industry understands that you simply cannot lie to a government agency?
The whistleblower's complaint was received, and the usual staff reviewed it and did the interview. It was not escalated to the leaders of the FDA who were responsible, and that was an error that's now been rectified in terms of process. In terms of the status of the whistleblower complaint, I'm not in a position to comment on whether they may be legal proceedings.
No, what I'm asking is, I'm not even asking about the whistleblower complaint. If a major corporation lies to the FDA about something as terribly important, the safety of infant formula, what are you going to do? And at the same time, they do billions in stock buybacks, huge compensation packages for its CEO. Is the government, is the agency going to say, sorry, it is more important to protect the babies of this country than to give huge compensation packages to your CEOs? Are you going to stand up to them?
Senator Sanders, we are standing up there. As I said, I'm not in a position to say whether criminal proceedings are underway or not.
Is that something in consideration?
I'm just not in a position to comment on.
Well, I would hope that manufacturers of baby formula, which is so terribly important to parents and obviously the babies, understand they cannot lie to the Food and Drug Administration, and I hope you are strong about that.
Well, Senators, you know I've worked on all sides of this. I've been inspected, and everyone understands when you lie to the FDA and you get caught, there's going to be big trouble.
Well, I hope there will be. Thank you.
Senator Collins.
Thank you. Doctor, like many of my colleagues, I've heard from desperate parents all over the state of Maine, particularly those that need specialty hypoallergenic formulas for their babies. One family from Sydney, Maine, for example, contacted my office after the mother had been spending 2 months making a round trip of 2 hours just to get formula for her baby from her baby's pediatric specialist. That's just not sustainable. Why wasn't there better communication with parents right from the beginning? Why did it take so long for FDA to start being public about this very serious problem?
Well, I guess my best answer to that is that as we were monitoring the supply up until about a month ago, there were issues, but they were manageable for the vast majority of people. And then things turned to empty shelves very quickly. And that's when we really wrapped up the public communication. There were concerns if there was a lot of public communication before that when things were manageable, that it would be understandable that families might purchase more than they needed to be safe, which, as I've already said, I'm not blaming them. That would be a normal response that we've seen in other areas with the pandemic. And so that's really basically the situation.
Well, I really think it would have been better if FDA had done what you said, which is put limits on how much could be purchased, but been more forthright with the parents who are really desperate. I want to follow up on press reports that indicate that the senior levels of FDA did not receive the alarming whistleblowers report due to, quote, mailroom issues. You blamed COVID-19 staffing issues for preventing FDA leadership from receiving direct copies of the whistleblower report, despite the fact that FDA's district office in Detroit received a hard copy from a confidential informant way back on October 26. Inexplicably, it took 4 months for that report to receive the attention and get to senior FDA leadership in mid-February. Let's look what happened. By that time, 1 infant had already died, 2 others were hospitalized, and the nationwide out-of-stock rate for infant formula had risen to 26%. I understand that the copy that was sent to then Acting Commissioner Janet Woodcock still has not been located to this day. What exactly do you mean by COVID staffing issues? Are you telling us that FDA still does not have people back to work in the mailing room and other portions of your agency?
Let me be clear about 2 things. The first is the hard copies of the document didn't get to the leaders that should have gotten it for the reasons that you just gave. But there was a second issue, which is the escalation procedures, because the people on the staff did get it, and they were dealing with it. And so there was not a procedure in place for them to inform the leaders who should have seen it, neither the center director nor the head of the Office of Policy and Response nor the head of ORA. And so I dealt with this in hospitals in the quality systems where nurses were not reporting surgeons' errors, for example. We fixed it, and we've essentially had to do the same thing at the FDA. So I'm not blaming the mailroom, but there definitely are problems in the mailroom. This is not FDA staff. These are contractors hired by the FDA to handle the Federal Express packages.
Are those contract employees, and are the 18,000 FDA employees back to work?
Yes, they've always been at work. The productivity of the FDA staff is higher than it's ever been. Remembering that
are they back, excuse me for interrupting, but are they back to work at their offices, in the mailrooms? I'm not talking about remote work. Are they back to work?
For the jobs that require being on site, they're on site, like the mailroom being one example. But for many of it, remember, our inspectors are distributed all around the country. They're mostly on the road. And our reviewers are reviewing documents using computers. So they're actually very efficient doing what they're doing.
But we need everybody to be back to where they would have been working pre-pandemic.
Well, I look forward to discussing that with you later. I think, I came from Silicon Valley, where it's very clear that for many of these kinds of jobs, that you're much more efficient working in a hybrid situation where you're in the office some, but also at your computer for a longer period of time.
Thank you.
Senator Casey.
Dr. Kaliff, last Friday I was in Pittsburgh, Pennsylvania at UPMC Children's Hospital and had a chance to listen directly to parents, in this case 2 parents, talk about their experiences with this infant formula crisis. Just note one for the record, because this is the reality for so many families. The father, first name is Manuel. He's got 3 daughters. One of his 3 daughters has complex medical needs. Her name is Francesca. She depends on a combination of IV nutrition and formula for her nutrition. Not having the right formula means 2 things: costly treatments and very high risk to her health. He said, quote, "She's stable this week, but we live in fear, not knowing if we'll have enough of the right formula next week or every week." And he went on to describe the challenges they face. So you and everyone in this room has heard some version of those stories, especially for children that have complex medical needs, but all children who need formula. I don't think there's any question that when Senator Murray and others have pointed to that timeline between, in your testimony, September 20th, when the FDA learned of a Coronabacter infection at the Sturgis plant, that time lag between September and then when the inspection was done and other actions were taken, you haven't provided a good answer for that. And the FDA needs to be held accountable for that, among other things, for that. But there is a lot of blame to go around here. Senator Murray made reference to the fact that on February 24th, she and I sent a letter to Robert B. Ford, chairman of the board and chief executive officer of Abbott in Abbott Park, Illinois. This is a February 24th letter from the chairman of a Senate committee, the Health, Education, Labor, Pensions Committee, Senator Murray, and we have not gotten the information that we asked for in that letter. I know they've provided some, but it is totally, in terms of a response, totally inadequate, especially in light of the findings that you have in your testimony on page 2 about the evidence of contamination. So this is a contamination problem for sure. It's also a notification problem when it comes to what the FDA didn't do enough of in terms of notification, but also what the company didn't do. So I've got legislation to impose obligations on both. One is to require manufacturers to provide timely notification of circumstances that are known to the company that are likely to lead to a disruption in supply chain. Companies got to do that, and they should be mandated to do that. But the FDA also needs to expand and accelerate these notification requirements, and the FDA has got to work with these companies to provide that notification. I also think you should have more authority to request records in advance of or in lieu of an in-person inspection. So my question is this. Talk about those authorities that you would need to oversee the infant formula supply chain. What's the authority you have now? What are the blind spots or the defects that we should fix by way of legislation?
We have almost no authority now other than to review the products as they come in, as has been noted. When it comes to this sort of an issue, there's no requirement now that firms notify us when they have an impending shortage. There's no requirement that if they find a contaminant in a sample in their facility that has not yet been shipped out, that they need to let us know. That happened in this case. There were Coronabacter contaminants previously identified that they didn't notify us about. They're not required to have a backup plan, a contingency plan, which I thought was, in every industry I've been in, there's always a plan for what if the plant goes down. If that plant had been hit by a tornado instead of a quality problem, the same issue would be in front of us now. And you have reports, I think 3 different reports to Congress now saying in a digital era, Right now, what we have is every company has its own supply chain that's considered proprietary. There is no central switch, and so there is no way to look and see, to stress test it, to ask the question, what would happen if a plant went out here? Is there somewhere else that could do it? And the idea that an individual company with 40% of the market share doesn't have a backup plan, to me, was inconceivable, especially since I have a history of feeling like Abbott was a reliable product maker for me in my profession. I was just it's upsetting and disappointing. But we need authorities to have that kind of information. When we have to ask and beg companies to give us the information about the supply chain and they don't have to give it, every little bit takes a long time.
Well, I'd say in conclusion, Doctor, there's no question that you should have that authority, and companies should be responsive to you, just like they should be responsive to this committee. But you've got to up your game, and you can't allow that time frame, that lag of time from when the damn inspection is done so that you can act on it. Thank you, Madam Chair.
Yes, sir. You said we didn't have a good response. I think we have a thorough response. It's not good. It was too slow, and there were errors made. I want to be clear that we acknowledge that.
Put it right behind me.
Thank you.
Senator Cassidy?
Hey, Dr. Kaliff. I'm sorry we're having to have such a contentious hearing. I think this graph demonstrates better than the graphs in your paper the issue. The summer before this began, or a summer ago, there was an 8% increase in the shortage rate on shelves. And it actually was increasing prior to this latest episode, and this is when Abbott was closed. So it seems as if there was something happening here. Now, there's a Politico article, you can put that down, thank you. There's a Politico article from May 9th, and I will quote it. One of the takeaways was that the food division has structural and leadership problems. Aside from the lack of attention of food at the top, unique problems in the Center for Food Safety and Applied Nutrition, a deep-seated culture of avoiding hard decisions, and a near-paralyzing fear of picking serious fights with food industry. And then it describes a power struggle between the top two officials, further strengthening the status quo of inaction. Now, to follow up on Senator Collins' comment, Zoom can work if people are actually communicating. But if there is a silence between the two, maybe actually being in the office and rubbing shoulders is somewhat conducive to information being passed. Now, I'm gathering from your answer that these two top leaders were probably Zooming, they were not in the office, and that their chief lieutenants were probably Zooming, and they were not in the office. Is all that correct?
They were in the office some, but in general, it's correct that most of the work.
And some, as you and I know, I don't mean to be insulting, but some can be 1 day a year, 1 day a month, or 1 day a week. Do you have a sense of what some is?
I'd say it depends on the individual that you talk about.
And of these two top, who apparently their structural problems and the deep-seated conflict between the two most likely is implicated here, how frequently were they in the office?
I don't have the data on that.
I understand that, but that would be useful to know. Now, it does make sense to me that if you have a dysfunctional mailroom and you've got a dysfunctional leadership and no one has actually seen each other, that it could take time for such a report to be done. And I'll just point that out, knowing that you, as the leader, will have to address that. Secondly, what percent, going back to, you mentioned how the inspectors are commonly in the field, but we know that HHS stayed shut down for far longer than the private sector. How many inspectors were, hold this up once more. We had a problem a summer ago. How many inspectors were actually not in the field working because of coronavirus? I'm not talking about the specific December function where there was COVID at the Abbott plant, but just in general, how many were Zooming their inspections as opposed, what percent of the workers, whatever, as opposed to actually showing up for work?
As you know, we have very limited authority to do inspections virtually. We actually need to have that as part of inspections, but the inspections were hands-on in the plant.
And so what
There were
percent
just
of your
fewer them.
inspectors were actually working as opposed to not being at work? Because HHS had a huge problem of people not showing up for work for 2 years.
I think from every piece of data I've seen, we have a very high rate of work. And I might also mention, I was at a pretty highly functioning business called Alphabet, which has done pretty well, where when you have the
I
kind
have
of work
limited
that
time, I
reviewers
accept
do-
that, but inspecting on site is different than what
Yes.
Alphabet does.
I agree.
And I don't mean to be rude. Regarding importation and labels, Canada, New Zealand, UK, all speak a form of English. Have we attempted to import from there, from non-FDA inspected facilities, knowing that getting FDA inspection can be prolonged, difficult, timely, et cetera, time-consuming? Have we attempted to alleviate by importing from English-speaking countries with standards similar to ours?
The short answer is yes. We are open to all the applications. We've got 26
Open,
already.
But I'm told that for that to occur, there's a 90-day lead-in period for the FDA to inspect.
That's not correct.
So if somebody from the UK said, I've got formula, it meets our standards, you can fly it in.
We can document most of what needs to be done without doing a hands-on inspection ahead of time, and we're doing that. I do want to address the Canadian
Can I finish
situation.
that one more thing?
Yes.
Are we actually importing from non-FDA inspected facilities in English-speaking labeled countries who meet our standards intuitively?
We are looking at those applications, and it's likely that we will, where we have high degree of confidence in reciprocal inspections that have been done by others.
So we have not started yet. Do you have a timeline of when that might begin? Because applications pending is a kind of, in an agency described as dysfunctional, could be months from now.
No, it will not be months, it'll be days. Every day you'll see a new one come on board.
Okay, thank you. I yield.
Senator Hassan.
Well, thank you, Madam Chair and Ranking Member Burr. Dr. Kaliff, like all of my colleagues here, I'm hearing from my constituents. Granite Staters have shared with me their struggles to obtain formula for their infants, and as we all know, formula for many, if not most of these babies, is a matter of life and death. Their parents are desperate and terrified. I've called on the administration to invoke the Defense Production Act and allow the importation of additional formulas, and I'm encouraged that the administration has taken these actions, but shortages continue and infants remain at risk. So what my constituents want to know is, when can New Hampshire families expect the shortages to end? How quickly will they be able to walk into a store and be confident that they will find formula on the shelves?
Well, I'm sure you know, Senator Hassan, I can't be exact about this, but my expectation is that within 2 months we should be beyond normal and with a plethora. And what you'll see is, due to all these measures being taken, the shortage is going to be getting better and better. And you'll also see the big focus is on these specialty formulas that all of you have mentioned. In fact, in the Abbott facility, that is the first thing to come off the line, because they were such a dominant company in that regard. And they've been able to move their timeline up now to within a month they will have that specialty formula out.
Well, thank you. So does the FDA have a plan and a timeline that shows how you plan to get to that point 2 months from now?
This is across HHS, and it is a lot of data points. So if you said, is it a simple chart, the answer is no, because there are many contingencies. But there is a committee that has all the data in hand, and if you would like something that's a little more specific about how the pieces fill in, I'm sure we can produce that.
I think it would be very helpful for us to get an actual plan, because without a plan, without goals, it is hard to know that you're actually going to meet them. It's also really important for the public to be able to understand when they can expect to have a little bit more peace of mind as they search for formula. Let me go to the issue of the specialty formula and the Operation Fly formula that President Biden announced. He announced that we are now using Department of Defense planes to pick up overseas formula and deliver it to the areas in need. At least 2 of these flights have arrived in the U.S. carrying several tons of formula. How is the administration prioritizing the distribution of the imported formula to rural areas and other regions where families have few alternative purchasing options?
Each application also has to include a distribution plan, which is reviewed at the level of HHS to make sure that the most needy places are getting the formula. I can assure you there's hyper awareness of the problems in rural America right now with health in general and access to care. So that is one of the priority areas.
Okay, well, I would love to follow up on that as well. And then I just want to turn to thinking through what we need to do once this current crisis is over. The FDA and other federal agencies need to take steps to make sure, obviously, that this never happens again. Supply chain challenges exacerbated by the pandemic made clear the need to build out domestic capacity to manufacture critical goods quickly, and that goes for infant formula as well as a number of other critical goods. What steps should FDA and other agencies take to prevent these shortages going forward? For instance, should the administration work to build out extra manufacturing capacity, stockpile the ingredients needed to make formula, require manufacturers to produce a reserve of formula, or to have the capacity to make extra in short order to prevent situations like the ones we face now?
Well, we have a number of measures that are before you now in pending legislation, as you well know, and those are enumerated, and we'll make sure you have a list of those. But you've mentioned a couple that are not yet decided where we do need to make a decision once we get on top of this crisis, and that has to do with the word stockpile.
Right.
There has been no stockpile of infant formula. It was not conceived of going back, and I think it's something that we really need to consider. Of course, if we had diversification of the market, and some federal agency, whether it's FDA or some other federal agency, had insight into the supply chains and how they fit together, the likelihood we would need this stockpile would be quite low because we would have a vibrant system that was resilient to stress. But we don't have that now. So between stockpiling and having a resilient system, we should be able to prevent this from happening again.
Well, we certainly need to. Thank you very much. Thank you, Madam Chair.
Senator Tuberville.
Thank you very much. Thank you, Dr. Kaliff, for being here today.
It's Kaliff, by the way.
Kaliff. My name gets mispronounced.
I understand.
Yeah. 18,000 staff members. How many of those? Many of those are back working full time, not from home. Do you know? Have a clue?
Well, let's distinguish. They're all working full time.
But back in the office. Do you know?
I don't know the exact percent, but it's not a large percentage.
It's not a large, or it is large? Okay.
Not a large percentage.
I'm just asking. You know, a lot of people are starting to work from home. Out of these 18,000 staff members, how many of these employees that you have been relieved of duty because of this? 18,000. Somebody's got to be fired, right? I've
been involved in running a lot of successful organizations. Firing is not necessarily the solution to a problem like this. Correcting errors is
Dr. K, people have died from this. People have died from this. Kids have died.
Kids have definitely died, but I don't believe there's a direct link between the plant and the sickness of these infants. It's been proven.
So everybody in your office has done 100% right. They've been 100%.
Absolutely not, and we're clear in the report that that's not the case, and that we are doing a review and putting systems in place and also reviewing individual decisions.
Okay. Let me ask you this. Last week you suggested the shortage would be over within a few days. Yesterday you said it might be weeks. Where are we at today with that?
As I just reviewed with Senator Hassan, it's going to be gradual improvement up to probably somewhere around 2 months before the shelves are replete again.
2 months. So you're in damage control here. What is the FDA going to do to store public confidence in this? Number one, in the safety, and then the availability of the formula in the days ahead?
Well, I think one of the main lessons of the pandemic was cyclical shortages. Is the only thing that will restore confidence is having adequate formula on the shelves. We're fully aware of that. The safety, we're not letting unsafe products on the market.
I understand that, but how do we get that out to the consumer, people that buy this?
Constant communication. We're going to have to constantly communicate about it.
Do you have a marketing department in the FDA? I mean, is there anything that consists of that?
We have a very hardworking external relations group and communications group.
Yeah. Who is your direct person under you that's overseeing this? The number one person you call every morning and say, hey, what's going on? What do we need to do? Where are we at?
It's actually twice a day. The person who's heading up the incident management group is Frank Yanis, who used to work at Walmart and is an authority in the supply chain area. The person running the center is Susan Main. We all meet together along with our teams twice a day to review what's happening and make sure we've got working orders for the day and also for the evening.
So the team of how many working on this one specific that you directly work with?
Dozens.
Dozens? Y'all work, and you meet every day, talk about it 2 or 3 times a day?
Yes,
Okay.
each one has a, if you just take the specialty metabolic formula that we discussed, this might be an infant with a hepatology problem where you got to have a liver specialist, a nutritionist, and a regulatory expert to make sure the infant gets the right formula. So it's a lot of people.
Okay. Thank you. Thank you, Madam Chair.
Senator Smith?
Thank you, Madam Chair. Welcome, Dr. Kaliff. So the Minnesota Department of Health was the first to link the foodborne illness to the powdered infant formula manufactured at the Abbott Nutrition Facility in Sturgis, Michigan in September of 2021. And they informed the CDC and the FDA of that link in September. That infected Minnesota baby survived but was hospitalized for 22 days. And as we all know, the FDA did not initiate an inspection of the Sturgis facility until January 21st, which led to the voluntary recall and the shortages situation that we're experiencing now. So this is my question. My question is about how the FDA coordinates with state and local health departments on early detection of foodborne illnesses. Is this process that happened with the Minnesota Department of Health, is that the standard process? Did something go wrong there? What can you tell us about what that link between state health departments and the FDA is and what it should be?
Thanks for asking that question because it's really important. The minute a report comes in, usually to CDC, because that's where the reports typically come in, there is an investigation launched, and it's very intensive. You have to get to the site, you have to get the cultures if they're available, you have to interview everyone concerned, and often you need to review the medical records. And in this case, the Minnesota Health Department, from all the reports I've gotten, did a splendid job. The problem is it was one case, and it was Chronobacter positive, but Chronobacter, for example, is found in up to 15% of sponges in kitchens at home. It's a ubiquitous organism. It's not necessarily. So that case was very well documented.
And was it linked to the formula?
It was.
I mean, they suspected a link.
The infant had ingested that formula, so
Right.
it was a
So
it was a matter of concern.
Yeah.
I'd also point out Chronobacter is not a reportable organism, and so we have banks of now DNA sequencing. If we look at the peanut butter case that just occurred, that was solved within days because we were able to link the genetics of the peanut butter and the sickness of the people, the genetics that were in the infections in those people, and the plant within days because we had the information. I think we need to do something about Chronobacter because it's a well-known, although infrequent, cause of contaminant of infant formula.
So, but are you saying that you think that the length of time that it took from when MDH, Minnesota Department of Health, issued provided this information, and when the FDA ended up, where the recall happened, is that as long as it should be according to the way your policies work? Could it be shorter? I'm trying to understand if there's something in that isn't
I'm
working.
sorry, I'm trying to give a nuanced answer in a bit. I mean, the Minnesota Department of Health did its job in what it should have done. We had one case. You don't recall a product unless you have a direct link that proves that the product actually caused the problem. So usually we get a cluster, as has happened in peanut butter, where a bunch of people have it at the same time. Then it's easy to make the case. In this case, we had the information and we had to wait and see what happened. Now, the time to the recall, as I've already said in my document, the more blunt answer, it was too long. We're clear about that in our documentation. and we aim to fix it.
Let me ask you about something else. This is about coordination with USDA, which is responsible, as you know, for purchasing nearly half of the infant formula in this country through the WIC program. My understanding is that the FDA didn't communicate with the USDA until around the time of the recall. I'm wondering why you think that happened. Should the FDA be working more closely with the USDA sooner, and whether you see this as an area where there could be improvements?
Well, let me divide this into two tranches. Prior to the recall, there was a lot of communication between FDA and USDA on the general supply chain issues related to infant formula. It was not about this specific case, but as I've already told you, even the leaders in FDA didn't get the information until February 9th about what was going on. That was an escalation error, as I've said, and we've documented that and are fixing that as a systemic quality problem within the FDA. And so it was shortly, as you said, the recall happened right after that. And so we were then in the detailed discussion with USDA. So there's been a supply chain, group of supply chain committees for government throughout the pandemic, and infant formula has been on the list that's been covered by the relevant agencies, including USDA.
So, Dr. Kaliff, I understand that you've only been at the FDA for a short time, but I do think that you have a unique capacity because you know the agency so well and because of your industry connections to be a reformer at the FDA. And I am struck as I listen to you today about how you have been explaining what happened with regard to this supply issue as well as the health issues, rather than taking the posture of a reformer, which is what I think that we definitely need. And I do believe that you have a capacity, a unique capacity to be that reformer. I believe that this infant formula crisis is a symptom of the broader systemic structural problems with food safety and in the food division that we have at the FDA. And so I urge you to adopt that reforming posture as we move forward.
Can I comment with permission on that?
Is not,
Continue.
As we discussed in detail yesterday in the hearing, I do consider myself to be a reformer here. I knew coming in, I'd gotten multiple phone calls. I saw the problems in the food side of the FDA before. It's been massively underfunded, and what I am appearing to be maybe defensive about is I do not think castigating the FDA employees is the appropriate approach to reforming an organization. What we've got to do is to have a carefully thought out plan going forward and an after-action review of all the decisions that were made with working with people to understand what's being done. If you take beleaguered employees and castigate them in an organization that's already under stress, I don't think that's a helpful way to fix an organization. I've been involved in many such organizations, but I agree 100% with what you said. If I'm not a reformer, I don't know. I mean, I wasn't planning to come back to FDA, as you know. I would not have come back if I wasn't planning on changing it.
Senator Marshall.
Thank you, Chairman. I appreciate it. Dr. Kaliff, welcome. It takes a lot of guts to come here and face this situation, and we appreciate you being here in person. You and I are both physicians. We both know that no matter what happens in the OR, the delivery room, or the ER, that we're responsible for it, regardless of what the people beneath us did, their actions, their inactions, that we feel that sense of responsibility, and I'm sure you do too. I want to start here by just reading a couple statements. This is a small sampling of what we've received. This is Stacy from Newton, Kansas. I have a 5-month-old grandson and another on the way. The shelves are empty in Newton, Kansas and the surrounding areas. Please help. This should be top priority for all Americans. Next, Anna from Wichita. This is unacceptable in America. How have we let this get to this point? No parent should be worried about not having food available in stores to feed their child. The empty shelves is what I expect to find in Havana, Cuba, not Wichita, Kansas. Judy from Overland Park. The new press secretary laughed today when a reporter asked her who the point person was for the formula shortage. She had no idea who the point person was. All I can say is may God help the babies. Janae from Cimarron, Kansas. The shelves at the stores are empty. How are we supposed to feed our babies? I believe the government needs to step in and get answers to the public and get the formula shortage resolved. Next, Katie from Manhattan. There's no room for bureaucracy when it comes to our nation's babies. And last, Lisa from Seneca. I'm an expectant mother due in June, and I'm terrified I will not be able to find formula for my newborn. We already have to worry about gas prices, inflation. I don't need anything else to worry about. What would you suggest I tell these moms, grandmoms?
Well, first of all, we are physicians, and the physician in a hospital or a healthcare setting is the captain of the ship and takes accountability. So that's why I'm here. Sure. And I would tell them that we are sorry that we're in this situation and we're working night and day to try to fix it at this point. And we know there's going to be further inconvenience and beyond inconvenience in terms of desperation that parents feel. But they also should contact us because we are dedicated when we hear about an individual case to fix it and make sure that everyone does get access to the formula that they need.
Thank you. I do want to submit for the record a letter that we sent to you. You haven't time to answer it yet with some questions. I think it was signed by 21 senators, so we'll submit this for the record.
Without objection.
Next, I just want to point out that, from an action standpoint, what has the FDA, what has the White House done to correct this problem? We're kind of bragging about a shipment of, I think, of 78 million, was it pounds or pounds of formula. Just to put some numbers to that, that's probably enough formula to feed the babies in Kansas for 3 or 4 days, and a fraction of what has been shipped in here. How much of the problem could have been solved if people weren't working from home in the FDA, if they would have been willing to go examine what was going on at the laboratory in Michigan, or they could have possibly went over to Europe and certified some of the manufacturing plants in Europe that Abbott has. We were all expected to work. People had vaccinations. There was every reason, I think, to go in there sooner, but I'm just afraid, and I guess the follow-up question is, the FDA still working from home, or are people engaged now?
Well, Senator, you're not just a doctor, you're an OBGYN person, and that has special responsibilities, I know. But it's also the case in most of the jobs at FDA, people are working 100% of the time or more. And I just remind you that I come from, in my last job, one of the most successful companies on the face of the earth, where people were working from home and more productive than ever. So I really don't agree with the contention that the work from home policies at FDA had anything to do with the outcome here. But I'm also not saying the outcome was a good outcome. I don't want to be misinterpreted that way. We just have a disagreement. And I think the right solution going forward is going to be a hybrid arrangement. As I said, it's most of the industry is going to, which is if you have a job like in a lab that requires that you be there, or in the mailroom, you got to be there. If you're reviewing documents or reviewing processes, you can do that from home. Just demonstrate that you're doing the work.
Thank you. Just a quick comment. I think this is a great opportunity for us to encourage breastfeeding. A great opportunity for encourage those moms who are thinking about weaning their babies today, tomorrow, next week. This is one more reason to try to breastfeed a little more, a little extra, and by the way, it's healthier for your babies. Anything you can do to help us with that, I'm all in.
I'm totally in support of what you say there. I did want to remind you I forgot what I was going to say. We do have a history on the importation front of very tragic outcomes with formula. Melamine, as you may remember, from imported formula not that many years ago. That's the reason we got to be careful and make sure that we are reviewing these documents.
Senator Lujan.
Thank you, Mr. Kane. I want to thank Chair Murray and Ranking Member Burr as well for holding this important hearing, and to Commissioner Kaliff for joining to share your insight and answer these tough questions, sir. Thank you for being here. Now, I, like many of our colleagues, come from rural parts of America, and that's where my question begins, sir, is in rural regions of New Mexico, Picking up the formula needed to feed our infants isn't as easy as going a few blocks to the closest grocery store. Many families have to drive hours to be able to take that trip to purchase infant formula. And when the supply chain fails and essentials are not available, it is not merely an inconvenience, but a crisis for those living in rural and underserved communities. Commissioner Kaliff, on May 10th, the FDA released a statement saying that the agency is, quote, compiling data on trends for in-stock rates at both national and regional levels to help understand whether the right amount of infant formula is available in the right locations, and if not, where it should go. My question is this. Is this system equipped to track the availability of formula in rural and tribal communities, some of which do not have access to broadband?
Thank you, Senator, and it's good to see you back, looking good too. What I'd say is the system is better than anything we had before. We asked for funding for a system to track this back at the early phase of the pandemic. We got no funding. We took money from other things, which I want to emphasize again, means that other things are not getting done. And we built a system which does give us some data, but not the data that we would really like to have down to the level of the individual location. You know, soon there will be broadband in every community, as you know, thanks to the good work that you all did to get the bills passed for that, but we don't have that now. So we're following it at the granular level that we can. And as I've made the point before, the industry actually has very detailed data about where its products are going. We have no right to compel the industry to give it to us and no right to demand increase in production until the President put in place the Defense Production Act. And so, you know, the answer would be yes, we have a system. It's nowhere near what we need.
Well, I hope, Dr. Kaliff, that everyone's listening to that and that the staff that you have here, we can work together to remedy that, make sure that the tools are in place for tracking, and then work with your staff to incorporate rural communities and tribal communities as well. I really appreciate that, and we have some work to do there as well, sir.
Yes, sir. I just might add, over the last 5 years, I've written a number of academic papers about rural health. There is a disturbing drop in life expectancy in rural America compared to urban that we all need to pay a lot of attention to.
You're spot on, sir. I appreciate that reminder. Now, the shortage of infant formula comes as New Mexico is experiencing the largest wildfires in our state's history. On top of the loss of their homes, cars, and livelihood, some New Mexicans are now struggling to source the formula they need to meet the nutritional needs of children. How is the FDA taking the impact of this disaster into account as they advise the federal government on the distribution of formula?
Thank you for that question. And having lived in San Francisco the last 5 years, the wildfires are quite an astounding thing that's hard to appreciate unless you see the size of these fires that we're now experiencing. I just want to make the point that the supply chain part of what we do is an HHS-wide and involves all other parts. It's an all-of-government effort, and I do want to commend colleagues around government. So they're constantly getting reports of where the shortages are and directing product to those shortages. And any area experiencing a shortage due to wildfire where people can't get around, please get in contact with HHS to make sure that they're aware. But I'm pretty sure they've got active feelers out to get this information.
Well, that's a good reminder to reach out to Secretary Becerra as well. And Dr. Kaliff, to everyone that'll listen, I remind them that this fire was started by the U.S. government. It was a controlled burn started by federal employees, by the U.S. Forest Service. And so we just want to make sure that there's attention on this one. But that's an important reminder. The other questions that I have, Mr. Chairman, I'll submit them into the record, but I'm hoping that we can do more in non-English language education and outreach, namely Spanish and into Native American communities, where in most areas across the federal government, we're still failing in that area, but especially with educating families to earn their trust back, to say these are safe products, this is where you can get them, and this is how to do it. So that's one area I look forward to working with you on as well, sir.
Thank you. That's a good example, by the way, of the labeling issues that we're facing as we import. So a lot of logistics here that have to be coordinated. Thank you.
Thank you. I yield back. Thank you, Chairman.
Thank you. Senator Paul.
There have been some discussion about whether the Abbott plant was not closed soon enough or whether it was closed prematurely, whether it was closed too long. There's no definitive evidence that the children who died, the bacteria came from the formula? That's a question.
correct.
Yeah. And I think it's important to know that. And I mean, it's very sad that the children died, but as the investigation has gone on, the unopened samples from the household, which would be part of the same batch, did not have any of the bacteria. The open bottle had bacteria, but coronabacteria can come from the environment in when you manufacture it, but it also can come from the home environment. When they do their investigation, I know they go back to the plant and take swabs everywhere. Do they also take swabs in the home environment?
In the home environment, I'd have to check to see whether that happens every time, but if there's suspicion about the home environment, it would.
See, I think it would be worth doing that because we want to know where it came from so we can prevent it happening from again. If you have other children in the house or you're having another child, it would be important. It's nobody's fault, but it would be important to know if there was coronabacteria found that matched the strain. But what we do know is what was found in the plant when you do the DNA analysis did not match the bacteria that unfortunately killed the children. On the issue of formula, how is a European formula different than American formula? Why do we prohibit it from coming into the U.S.?
We've never prohibited European formula from coming into the U.S., but we do have requirements that have arisen over time. There are 30 nutrients that need to be in a specified label and specified amount, and 10 that if they're too high are dangerous. So we just need to make sure that the requirements are met.
Are we waiving?
We've been importing, by the way, the American manufacturers that we talk about have plants in Europe and Mexico that have been importing all along.
Are we waiving any of the requirements to try to fix the shortage?
We're not waiving basic nutritional requirements or safety requirements. We're waiving some of the labeling requirements that are time-consuming to get exactly right.
When you say that we don't prohibit it, you're right. There's not a law or an FDA edict saying you can't have it, but there are a lot of restrictions on it that do effectively prohibit it. Some of those are labeling. So we are waiving the labeling things. Do you think it may be a good idea to maybe permanently get rid of some of these labeling requirements that are keeping European or Japanese formula out of our market?
Well, I disagree that that's what's keeping them out of the market, but we'll continue to look at the labeling to make sure it's leading to safety. Remember that an error in mixing up the formula can be devastating to an infant.
Yeah, but I think Europe has those same concerns too, so does Japan, and I think this gets back to the basic question of whether we trust, international standards on things or whether we don't. And I think it is part of it. If you're loosening the labeling requirements now to get more in, then the labeling requirements, obviously, you believe are limiting it. So by loosening them, you're expecting that you'll get more formula. Some of the differences, I think, would be and could be considered a matter of opinion. How much iron is in the formula? I think we have more iron than Europe has. Europe has more omega-3 fatty acids. I don't think there are doctors over there consider or there's an outbreak of iron deficiency in Europe because their formula is less. So I would say that they could be honest, expert differences on exactly what formula should hold. Would you agree?
Yes, Dr. Paul. I mean, I'm a huge advocate of global coordination for basically the reason you gave. We're all human beings. The diseases we have don't know borders. And where the requirement is good, we should take it into account. Right. And of course, the availability of cloud computing and internet makes it possible to do this in real time, but we're not there yet.
Right. Well, I would venture to say we are there. I mean, I think that part of what you're going to do is try to evade the rules that have restricted the flow of foreign formula in. It also would serve to have more competition. If you do have a problem, I'm not so sure whether the Abbott plant should have been shut down for so long, but the thing is, if you had more foreign formula flowing in, and I think that there's nothing wrong with the European formula. There's probably nothing wrong with the Japanese. There's probably nothing wrong with the New Zealand. So there does need to be more coordination. I don't think it's like, oh, we got to wait till sometime in the future. I think right now it's completely safe, and people ought to get the choice of where they buy it from. We've proposed legislation that would get rid of tariffs also. There's a 17% tariff on it. I think the agreement between Mexico and Canada and the United States that was signed in the previous administration put an extra tariff on Canadian formula and Mexican formula. So those are economic barriers to it, and we got to look at the whole picture. Closing down Abbott, I think probably too long since there's no proof that the deaths actually were related to Abbott, and sort of I think the overreaction in some ways to the link and not really following the science has led to a lot of this. But I think also the economic barriers of tariffs, but also I think the overly zealous regulatory environment as far as what goes into it. Nobody wants dangerous formula, but nobody also believes that the European Union is like, delivering millions of babies in Europe dangerous formula. And so I think there does need to be more international acceptance of things, and I think you're doing some of that. And I commend you for doing it, but you're evading your own regulations right now, which is good, because I think some of your regulations don't make any sense. And so I think we should, by legislation, address, the needs of formula and see where there's a dispute. I'll bet you we could bring in a whole panel of scientists that agree that the European formula is just as good as ours or better. And it would be a dispute. There are probably hundreds of papers written back and forth over what the level of iron should be. So I don't think there's any ironclad truth. It's another reason why we shouldn't have anyone dispensing what truth is, because truth is debatable, and people look back and forth and actually have opinions as to what the truth is. And I think we need to be more open-minded as far as this goes. But I do commend you for trying to get outside the regulations to get more formula in. But I think we have to look at whether or not it was an appropriate length of time that Abbott was closed down, given that the evidence does not definitively say that the bacteria came from the plant. Thank you.
Madam Chair, can I make 2 quick points?
Yes.
On that? Number one, for those who argue that onshoring is the solution to all of our problems with our supply chains, this is a classic example of why that's not the case. This was almost all onshored material, and the industry couldn't produce what people needed. The second, on the Abbott plant. Abbott would completely, now that Abbott has taken into account their own failings, I think they would agree completely with us. They're not ready to open. They've known for 3 months since they've been shut down that we were going to go through this court proceeding to gain control of their quality system. They've been working on it all along, and I do think they're doing a good job now. But they had to replace the roofs, replace the floors. They're still not done. And we went over with the CEO day before yesterday the detailed list of hundreds of things that they had to fix. And you just can't open a plant with bacteria growing in it. I mean, would you go in a kitchen next door if there were bacteria growing all over the place and standing water and people tromping through with mud on their feet, which is essentially what the inspection showed. So I do agree with some of the main points you made, Senator, but I just, on those 2, I wanted to make sure my feelings at least were known.
Thank you. Senator Hickenlooper.
Yes, and thank you, Dr. Kaliff. It's great to have you back. I appreciate your willingness to come back and not just subject yourself to these questions, but for your service. I was going to try and catch Dr. Paul before he left, Senator Paul, just because I thought it was unique. First time I heard him make a pun like that, where he was talking about the amount of iron in formula and getting to an ironclad solution, but somehow that got passed over. Obviously, the grief that we feel on behalf of those kids it's only compounded this week just after what's happened in Uvalde. And these are circumstances and situations we wish we could repair. But I do appreciate what you're trying to do to go back through the entire process and see where the mistakes were made and then figure out how do you build back a better structure so that we catch the next time we catch it sooner, or perhaps we even avoid it completely. And I thought your comments about how to reform an agency made my heart sing, because that's exactly what you've got to do. You've got to look at the culture. You've got to make sure the culture can't, and they are beleaguered now, they've been underfunded, they're short-staffed, they've got to believe in their future, and I think that you understand that and are going to move forward. Now, back to the supply chain management. We continue to react to supply chain interruptions, rather than proactively plan ahead. This is, I think, your inclination to intervene so as to prevent them. Does the FDA have adequate access to the critical supply chain information that you need, not only to address the current formula shortage, but also to help minimize the risk of similar shortages of other life-saving and life-sustaining products?
Short answer is no. If I could take just 30 seconds to just go on about this. I'm a huge advocate of free enterprise and of the individual companies making their decisions that are in their interests. It's worked great for America. But what's happened is each company has its own supply chain, its own optimization, and when someone says, if company X gets in trouble, will we have a supply for that community? On the drug side, we just got authority to require that companies notify us when there's a shortage. We had over 300 last year that we had to help with. And if you talk to hospitals and health systems around the country, they are every day dealing with significant shortages. I would refer you to 60 Minutes last Sunday. Yet for food, we have no authority to compel companies to give us the information, and we even have to pay for it very often to get it, which just seems ridiculous. They have digital information. There's no reason it couldn't be transferred, and there's no reason for the government to intervene except in the case where there's a public health need.
And that's something we might be able to help you with, I suspect. How can we, at that, and this is just a continuation of that thought, at the federal level, support platforms like 21 Forward, analyze supply chain data?
I really appreciate that question. I have to be careful here because I came from the best computing environment in the world back into the federal government, which is, as I keep saying, full of, I just want to say it over and over, very hardworking people, not people who are sitting at home, lounging around. These are hardworking people, but they're greatly impaired by legacy systems. Anyone that's been involved in the technology industry knows that you have to update your systems. Companies have capital budgets. As you know, you've run companies, and you put it into capital equipment, and that's an expense that you take. We are woefully short. We're doing the best we can with gum and chicken wire to put things together. But ultimately, there's going to be a reckoning on this in the federal government. I would also point to CMS as a group that needs help, with whom we're doing a lot of work. But on the food side, we just need fundamental funding and technology to enable us to do our work. Imagine an FDA inspector armed with the kind of equipment that I saw at Google, how much more efficient they would be in getting their job done because they're not hand entering data into an old computer.
Exactly. Well, at some point, we did an infrastructure bill this year in the Senate that was bipartisan, and I think maybe one of the next big things we should look at would be a technological infrastructure for government, because we are, in almost every agency, decades behind, not just a few years out of date. Maybe I'll just lay this question out, and you don't have to answer because I think I'm out of time. Based on the information you have, what do you see as potentially, maybe I'll let you have 15 seconds to answer, with the chair's permission. What's the next supply chain crisis for critical foods or drugs under the purview of FDA? What do you see as looming problems?
Well, we already have one, which is contrast media, which is the opposite of the onshoring problem that we had here. We had a major manufacturer, GE, which had its only plant, I don't know all the details, making contrast media in Shanghai. And when the COVID problem hit there, they shut down, and all of a sudden, we've had a number of medical illnesses in Congress lately. Someone with a stroke or heart attack wouldn't be able to get an angiogram. I mean, it's just unbelievable. But it's happening, and I could give you a list of dozens where we're precariously. This is just in time, which is very efficient when things work well, with very little inventory. That's the most efficient way to run a company. But then when something goes wrong, if it's not a critical supply you need for health, okay, so you don't have tennis shoes for a couple of weeks. No one, you make up for it. But when it's a critical thing, like
I'm going to interrupt here. We do need to move on. Thank you. Senator Scott.
Thank you, Chair, and thank you, Ranking Member, for holding such a really important hearing. One of the things, as I've watched this hearing all morning, frankly, I keep hearing is who should be to blame for what didn't happen. And the one thing I think Americans are really not very interested in is to watch each side point fingers at the other side. Some say it's the private sector, some say it's government. The fact of the matter is that the average person in this country is not as interested as we are, is figuring out how to make a Republican responsible for what happened, or the Democrat to be responsible for what happens, or the private sector to be responsible for what happens. This, frankly, seems to be an all-hands-on-deck kind of problem. Everybody did something that they ought not have been doing, or didn't do enough of what they should have been doing. So from my perspective, I'm not sure your opinion on that, but the truth of the matter is, it's pretty frustrating for the average person in our country who's sitting at home watching a crime wave that they haven't seen in decades, looking at the price of gas at the pump and they're scratching their heads and they're digging into their pockets and they're coming up a little too short, a little too often, month in and month out, and then they see the absolute crisis of inflation that is weighing on their shoulders and their inability to meet the needs that they were able to meet just 18 months ago. And then finally, for mothers, fathers, new kids, they see this shortage of formula that seems to exasperate their situation in such a way that they simply can't imagine it happening here at home in America. And Dr. Kaliff, I hope that we spend less time pointing fingers at who's to blame and take responsibility for where we can make things better. You're a South Carolinian born in Anderson, South Carolina, and as Senator Lujan was talking about the rural aspects of his state, I will speak to the rural aspects of our state. You went to A.C. Flora High School, I went to Stall High School, and the fact of the matter is we played ball against each other, different decades, but same schools. The truth is that too many Americans in too many places, and specifically at home, are looking at the crisis that befall them, and they want solutions, not really the blame game. So I hope that we spend a few minutes on how do we make sure this doesn't happen again? But before we get there, I just want to highlight the fact that in your home state, as I just suggested, in my hometown of Charleston, South Carolina, we have 4 babies in hospitals due to the shortage because they've had an allergic reaction to the generic form, so they need a specialized formula. What can we do to accelerate the path to those families having what they need, and how can we ensure that this doesn't happen again?
Well, to your first question of what can we do for the specialty formulas, as I've reported, we have groups of FDA people, pediatricians, specialists in critical care who meet every day and talk about each case and try to get the right formula to the baby. In the case of Abbott, which was the major manufacturer of these, for the hyper-specialized formulas that had no substitutes, we actually have allowed on a case-by-case basis the formula to be sent out after careful weighing of the risk and benefit since they were made in an insanitary plant. For the next tranche that you're describing, it's right to try a different brand, which is considered to be interchangeable. But we all know that when it comes to particular drugs, for example, sometimes what looks like the same thing doesn't sit well. And then what has to happen is trial and error. But there are specialists involved every day in helping to navigate these. You have great ones at MUSC. I know the institution well. And I'm sorry that infants have to be in the hospital. But for that kind of critically dependent infant, it's probably the best place for them to be until we get everything back and running.
And transitioning to the latter question as it relates to how do we ensure that this doesn't happen again? The safeguards, the whistles, the bells that should be going off when we're at 11% shortage, 20% shortage, 30% shortage, 40% shortage. How do we look back and learn lessons that we use for the future?
Well, there's an old statement, there lies, damn lies in statistics. So Senator Cassidy and I have very different data. He showed the most extreme estimate. Our estimates are nowhere near what he showed. But having said that, we have a very specific list, some of which are in consideration in upcoming legislation that we're glad to share with you. The big question that I think is going to have to be addressed is, do we create a stockpile as a backup in case something doesn't work in the future? I do worry. What happens is that we're getting the Abbott plant back up there, positive cultures would be one example. I think we're going to have a surplus. We're certainly planning on a surplus within a couple of months, as I've already told you. The question is, should we maintain that surplus as a government activity for the foreseeable future? And that's a question we're all going to have to discuss together and make a decision about.
Thank you. Senator Baldwin.
Thank you. Thank you, Dr. Kaliff, for being here. I am aware of the resource constraints that the agency is under. But I want to make sure moving forward, that the FDA has the resources it needs to keep all of us safe. But I'm not sure that this crisis is solely due to a lack of resources. As was indicated earlier, there was a sort of in-depth review in the Politico back in April of the food safety not being a high enough priority, a big enough priority at FDA. And it's part of why we're here. So the failure to prioritize food safety has put infants at risk. I know we're hearing examples of what's happening in our home state. I've heard from the Children's Hospital of Wisconsin, families coming to the ER because they couldn't find specialty formulas for their children, and there were babies who were hospitalized in Wisconsin because they did not have access and enough formula. This is not the first time that we've experienced a recall for a product made at Abbott's Sturgis facility, correct?
I think that's correct.
I'm aware of a recall that occurred in 2010 and a citation that was issued to the facility in 2019. Is that striking?
Yes.
Okay.
Yes, I actually have a chart, but I had forgotten the exact date, so I apologize
Yeah.
for that.
So in the past decade, given that history, how many inspections did FDA conduct at the Sturgis plant, given a poor track record evidenced by the prior citation and recall?
There were a whole series of inspections, as you know, leading up to 2019, most of which did not show any major problems. And then we had the most recent inspection, September 2021. I think I could get the exact date. You know what it is. It found 5 citations, including inadequate hand washing and standing water in the facility and several other infractions. That led to what's called a 483, which is a written citation, and then the company's responsibility is using its quality systems to fix it. And
you're already anticipating my next question, but before we jump into the September 2021 inspection, would you agree that additional inspections and better oversight of this plant were warranted based on past performance, but especially because of knowing just how critical this plant is to our nation's supply of infant formula?
Yes.
Okay. So in September of 2021, FDA officials entered the Sturgis facility and, as you indicate, found pooled water, and they also discovered that the plant had found Chronobacter in a finished powder formula lot from June of 2020. But according to reports, the inspectors did not swab for the bacterium during this September 2021 visit. Is that true?
They sample the product, but not the environment. So I think the way you asked the question, you're correct.
Okay, so to be completely clear, we're talking about powdered infant formula being manufactured in a facility with a leaky roof, with cracked spray dryers, with puddles on the floor, and this same manufacturer knowingly disposed of a contaminated product, and yet FDA inspectors did not swab for samples.
Well, at the time, the leaky roof I don't think was known, but everything else was. So the intent of your question, you're correct.
Okay. Thank you, Madam Chair.
Senator Braun.
Thank you, Madam Chair. I'm going to have 2 lines of questioning here. One is about the industry itself. I've been a proponent since I've been here because I come from the realm of full competition, price transparency, markets that have hundreds of players in them. I know it's not your bailiwick, so to speak, but do you feel comfortable where you'd have 3 companies that control 98% of the supply of baby formula, and when it comes from the specialty formula, 75% by one company, Abbott. Is that a good place to be? And how much of that concentration is due to regulations and the involvement of FDA along the way? It's kind of a broad question, but...
Well, I'll give two. I mean, there's a short answer to the first part of your question. No, I'm not comfortable. It's not good for the country to have such an undiversified supply chain and manufacturing chain for a critical product like that that's used by so many people. I don't think FDA regulation is at the basis of that. Anyone who meets the criteria within the U.S. or outside the U.S. that wants to import can bring formula into that market. We don't restrict the market, and we have absolutely no control over the market.
So I think that I want to be on record that that is not a free market. That's an oligopoly minimally. It's a monopoly very nearly. So, and that's not only the case in baby formula manufacturing, it's a case in a lot of our ag markets, our broader healthcare markets for sure, and something has got to be done if we're not going to have issues like this, even if a company does pretty well most of the time. Got a question about the WIC program. Is there a peculiarity where on anything that goes into it can only be gotten from one company, or in that particular, which I think is about 50% of where baby formula goes, is that something that the FDA has directed, or am I off base that that's even part of the way the system works?
The WIC program is run by the Department of Agriculture, so it's completely outside of the scope of the FDA.
Okay, so I'll deal with that with the Ag Department. Let's look at the timetable of when it looked like things were heading in the wrong direction. Of course, we shut down so much of the supply chain, I think in a misguided way along the way, but there were cues, a year ahead when it went up to 8 to 10%. Senator Scott mentioned that, it got up to where it was close to 50% of not having the right amount of inventory on shelves. And I think that part of that time when this all occurred, including the dust-up with Abbott, Dr. Woodcock was in charge. Is that correct?
Yes, that's correct.
Okay. And then haven't you appointed Dr. Woodcock to now be the troubleshooter kind of on this? Or is that,
no,
she's back, is she back in the program or working for the FDA?
Well, she's the principal deputy. She's a career FDA employee who's...
well, I think that would beg the question when you had somebody that was there when most of the problem occurred, about midway through at least the Abbott issue, how it makes sense that she'd be back in. But let's look at...
Sir, if I may, we did appoint someone else to oversee the look back at decisions that were made there. Steve Solomon, who's not working under Dr. Woodcock in this capacity.
Let's get back to the incident itself. So roughly, first of all, Abbott was vindicated on the particulars, the merits of the issue. They had no contribution to those sicknesses, correct?
With all due respect, I wouldn't use the word vindicated. We can't say with certainty that the cause was there, but it's so rare to have 4 cases of Chronobacter, all from the same...
But you haven't been able to connect the dots, and they may still be in that position to where there was culpability.
That's correct.
Why did it take roughly 2 months after 9 to 10 months of the formula shortage saying that, hey, we better be on full alert, to actually get through the particular issue itself? And then once you seem to come up with an idea that there was not a connection, at least in the short run analysis, that it took another couple months, and then at that time, the shelves were empty to get Abbott back in the business of doing what they were doing.
We saw the lack of quality in the system and the lack of accountability for the problems that were there, and so we had to invoke the Justice Department to negotiate a consent decree, which is essentially Abbott saying, yes, we had all these problems, here's exactly what we're going to do to fix them. For legal reasons, I can't discuss the exact details of the negotiation, but let's just say that it took a little arm wrestling to get to the point where the Justice Department got Abbott to sign the consent decree.
Well, I think it's clear that we got too many eggs in one basket when it comes to producing the stuff. And I think it's also clear that it got caught in a regulatory morass that took more time than what was necessary, and now we're dealing with it after the fact.
We completely agree it took too long, and I also want to agree with Senator Scott that we're not trying to blame everybody else. We have our own issues, which I think are clearly laid out in the documents that we've given you, and we will be accountable for fixing those going forward.
Thank you.
Thank you. Senator Rosen.
Thank you, Chair Murray and Ranking Member Burr for holding this hearing. Dr. Kaliff, for your participation and your clear answers for everyone. You know, my home state of Nevada has been hit especially hard by our current formula shortage. There's a reduction of at least half of available supply. A recent report ranked Las Vegas as the metro area facing the worst shortage in the nation. So our local community organizations in Nevada, we have 3 Square, Babies Bounty, the Women and Children's Center of the Sierra, among so many others. They're really doing incredible work to get the formula to those who need it the most, but they are stretched so thin. And so recent actions by the administration are a start. We know they have come too late. I know you have addressed some of that, but what I'm concerned about here is we talked a little bit about the Forward 21 program, and that's a pilot program you're setting up to monitor and report on food supply chain disruption and vulnerabilities. So where's the status of that? Where are we at? And I really want an answer to, before I go to some other Nevada issues, is there a national phone number that parents who can't find formula, who can get help? Are families is there a place where they can find about homemade recipes? We don't want people making dangerous things, so maybe if you could answer those.
Yes, HHS has a website, hhs.gov/formula. And it has each of the manufacturers. For example, you have an infant that's been using a particular kind of formula, you can call it, the hotlines are there. And if there's not an answer otherwise, there's a number you can call there for HHS to get help. So that would be the most immediate thing to do if there's a problem. You asked about 21 Forward. Would you like me to comment on that? Or?
Yes, please, because I think that would, if we can implement that, that may help us going forward with vulnerabilities and supply chain disruption.
As I said, funding was asked for that. It wasn't given, so we've borrowed from other FDA programs. We're not where we need to be. Just for example, there are 220,000 registered food facilities in the United States. So a system that is used for infant formula but also has more general applicability to the foods program, it's got to be a robust system, the kind that I'm used to working with in the private sector. We're making progress, but we're nowhere near where we need to be.
Well, maybe we can help you with some funding there. But I want to follow up on something Senator Hassan asked about, the distribution of the formula coming in for military flights. How is it being decided beyond existing supply chain routes? Are the areas that are hardest hit with the worst shortages, like Las Vegas and other parts of Nevada, are they being prioritized?
Right now, the specialty formulas are the priority, so they're going to wherever babies are who need specialty formula, which could be anywhere. My expectation, I'm not on the supply chain committee, which is, I think you know, is a government-wide committee that's been guiding us through the whole pandemic, I would say quite successfully, considering the problems that we had early on in the pandemic. And I would expect that they are going to send the more general formula to the places in greatest need at first, including, I think a special problem has been alluded to. If you're in a rural area, you may be a small place, so you wouldn't show up in a general measure. And I know that's going to be taken into account.
Thank you. You mentioned that you weren't on the supply chain committee, but I do want to talk about staffing and FDA staffing, because according to the American Academy of Pediatrics, FDA has 13 staff members to regulate and monitor safe production of infant formula, and no staff assigned to supply chain issues. Is this currently still the case? Have you reassigned the staff to oversee the supply chain issues for baby formula? This 21 forward, this formula is essential, and children can't wait. Like you said, it's like a pair of gym shoes.
As I've already mentioned, we brought in staff from other areas of FDA, which means other things are not being attended to that the public would expect, but this is the top priority, and you know that there is legislation pending that would fund additional people for this purpose. They're desperately needed. We have really only 9 because the other 4, we just got the funding a couple of months ago, and it's going to take a little while to identify and hire the people. So we've had to bring in other people, but from other programs.
Thank you. I see my time is up, Madam Chair.
Thank you. Senator Burr.
Thank you, Madam Chairman. Let me just say this, Dr. Kaliff. I'm not sure that there's a seated member of Congress that's defended the FDA workforce more than the one sitting in front of you, and the role of the FDA. And I got to admit, I was quite amused to see 2 doctors use the same data to come to 2 different conclusions. I was shocked that would happen. I think it happens every day. But here's some of the real beefs. Will you provide for this committee all the inspection reports on the Sturgis facility since 2019 and the deficiencies that were raised with the Sturgis facility?
I will commit to provide everything I legally possibly can. I don't know if there's anything that's enjoined because I've said I can't comment on.
Let me put the end date as September 21st of 21, so it doesn't get into the current time period that we're talking about.
I think it's, as long as it's legally permissible, I'm committed to do that.
It's my understanding that there wasn't even an inspection that was done in 2020. Do you know whether that's accurate?
That's accurate.
It's accurate. You said Abbott didn't submit paperwork on April the 8th. I just want to dig a little bit deeper. Did Abbott not respond on April the 8th to the 483 that FDA issued where they detailed corrective action at the Sturgis facility?
That was their first take on corrective action, but
they submitted to FDA a detailed corrective action paper on April the 8th.
Not an adequate corrective action report.
Okay.
I mean, Senator Burr, I've been on the other end of inspections in almost every industry, and usually when something has not gone right, the company has a particular perspective. It may be a little oriented towards the well-being of the company, not necessarily the needs that the FDA saw. So there's always adjudication back and forth that has to go on.
It's my understanding that in every case that we've tried to fill a nutritional need that only Abbott made with foreign products, that Abbott has paid for those products. Is that an accurate statement?
I don't deal with the funding of those, but I do believe that Abbott has made a good faith effort to cover the costs. I just don't know the details.
So you said earlier that you weren't going to throw the mailroom under the bus. But yesterday, FDA statements basically did that. Square for me the last 24 hours as it relates to that.
First of all, let me just comment. I do believe that despite our contentiousness at times, you have supported the employees at the FDA. So I don't want it to be taken that I don't believe that. I just believe it's my job to defend hardworking people. But as for yesterday, I just want to be clear, and I think we were yesterday. There are 2 issues here. One is that something went wrong in the mailroom. The other is we didn't have an escalation policy that caused the employees who were dealing with the complaint to escalate it to the relevant leaders, including all 3 of the leaders who should have gotten it. So I'm not blaming this on the mailroom. Either one of those methods would have gotten the report to the proper people.
Let me just read it for you because I found this sort of shocking. FDA leadership did not receive direct copies of the complaints due to an isolated failure in FDA's mailroom.
That's direct copies of the complaints. Specifically, FedEx sent the package that had 5 people addressed. There were 5 packages. There are 2 different facilities, one at White Oak. The food part of the FDA, as you may know, is up in a different part of Maryland. The direct copies didn't get to the people. They were actually sitting in the receiving dock. But that doesn't mean that employees...
All I'm doing is reading what was said yesterday. It said it was...
But Senator Burr, that's one statement out of an entire report that goes through the other aspects of this about the escalation procedure.
All right, let's go to budgets, because you've been pretty across the board. Budgets, we don't have enough money, we don't have enough money, we don't have enough money. So you got $718 million in COVID emergency money. The Omni, which, yeah, it was in March, gave you $11 million for maternal and infant health and $10 million for inspections. That was 60 days ago. How many additional inspectors have we hired as of today?
I don't have that number in front of me, but I'd be glad to get it to you.
Provide it for us, if you will. Let me end on this. The Food Center's budget is $1.1 billion. I don't think that's gum and wire. You stated that you were putting together things with gum and wire earlier. I think it was to Senator Paul or somebody. I think $1.1 billion is a pretty substantial amount of money. Now, the chairman and I realize I'm over my time, Chairman, but I'll be brief. Chairman and I are negotiating the next round of user fees, and we're extremely close. FDA is sitting before us in the midst of a large failure. As an agency, since it was created, and once again asking for money with more authority, more money, less accountability. So I say to you and I say to the chairman, I'm going to go home and I'm going to try to think about this as to whether now is the time for us to move forward on finishing our user fee negotiations. It may be that finding all the answers to this question is increasingly more important than expediting something that really doesn't have a finality until the end of this year. Madam Chairman, I'll work with you as aggressively as I can on this, but I also want to work with you as aggressively as I can to get the answers to the questions that are unanswered today on infant formula. I yield the floor.
Thank you, Senator Burr. That will end our hearing today, but let me be clear, Dr. Kaliff, it will not end our focus on this. I'm going to keep pushing to see that plan I mentioned earlier. I asked for it weeks ago, and I will not stop pushing until I see it. This is life or death, and Dr. Kaliff, it simply should not have taken this long. I'm going to keep pushing to get formula on shelves and to families and babies. I'm going to keep pushing to get answers for parents in Washington State like Mac, my constituent, about how they can get what they need. Because Mac did speak with his pediatrician weeks ago, and they could not even find a sample can. And let me be clear, just asking parents to call HHS is not an answer. Parents from the Tri-Cities where he is or anywhere else should not be trying to figure out this for themselves on Facebook. This is a national crisis. It involves international supply chains as well as nationwide distributors and retailers. It is unacceptable to leave families fending for themselves. Parents like Mac need one simple place to find information they need and get help. We need one clear coordinator managing this multifaceted problem and helping parents and hospitals and pediatricians and state officials and everyone get what they need to figure this out. This should have happened days. This should have happened months ago. This shortage should never have gotten so out of control. And understand, I am ready to work with you or anyone else to fix this, but I'm not going to stop pushing everyone I can. You, HHS, President Biden, Abbott, other formula manufacturers to do everything you can to fix this as soon as possible and to make sure that this never happens again. With that, for any senators who wish to ask additional questions, questions for the record will be due in 10 business days, June 10th at 5 p.m., and this committee stands adjourned.